Okay, we're here on another edition, another conversation here. We've got a special guest today, Dr. Jeff Barke, along with Supervisor Jim Desmond. And Doctor, thanks for being here. If you don't mind kind of giving your credentials and then kind of tailor that into why you've become vocal in this COVID-19 pandemic.
Yeah, absolutely. First of all, thank you, Supervisor, for having me. I appreciate the opportunity to share my perspective with a wider audience. I'm a board-certified primary care doctor. I've been in practice in Newport Beach for over 25 years. And I didn't really look for or desire an opportunity to have a national or even apparently an international voice. Rather, it was accidental that a couple months ago, my wife and I were invited out to Riverside. There was a rally going on prior to the Riverside County Supervisors meeting where they were going to vote to open up the county of Riverside. And I was invited to come out, and I begrudgingly came along. And they asked me to say a few words, and I did, and invited my wife to take a picture of me so we could send it to my kids because I thought that'd be kind of fun. Instead, she hit the video button rather than the photo button on her iPhone and recorded about a 6-minute piece of me saying whatever it was that I was saying. Later, she posted that on Facebook. And before long, I've got folks from all over the country and the world inviting me to share my perspective. I've written some op-eds. My daughter even created some social media channels for me. And here we are. And I'm honored, and I don't think things happen by accident. So for whatever reason, I've been put in this place at this time. And I believe there are hundreds, if not thousands, of physicians around our country and around the world that have a similar position as I do, but are either too frightened or don't have a platform to share their perspective and what I think is a common sense perspective. And we need to get away from this fear-based reaction that we're all having and try to put things in perspective as to the path forward as it relates to COVID-19.
What did you, on that video, what did you say or what did you say that kind of resonated with people?
Well, what I said was that I questioned the experts. And I said, what if the experts are not actually correct? You know, what if hydroxychloroquine actually can make a difference? And what if masks, although I don't really have a problem with them, but what if they aren't really the answer to keeping us all safe? And what if children aren't actually at risk and opening the schools is something we should be doing, and that closing down our economy is actually hurting more people than it's helping? What if some of those things are true, but we're not hearing that perspective on the mainstream media, but rather the only thing we're hearing on the mainstream media is fear-based information that's leading us astray and is harming more people than it's helping?
Well, and I tend to agree with you. You know, this is all new to all of us, and nobody really has all of the answers yet. And I think we have to take a common sense approach to this and say, okay, how can we? You know, we're going to have to learn to live with this virus like we have in the past until there's a vaccine. You know, how do we manage and live with it and protect those that are the most vulnerable? And you know, it appears that those over 60 years old are more vulnerable, much more vulnerable than those younger than 60 years old. So to keep our workforce idle or you know, almost shutting down the economy, getting to 30% unemployment at one point in time, we're still at around 15% unemployment. To me, I think, you know, we need to protect those most vulnerable, but we have to have the economy back, getting people back to work so they can put food on their tables. It's kind of our Health and Human Services Department in San Diego County costs about $2 billion a year. And that includes, you know, care for seniors, care for child welfare services, child foster care, for food stamps, all of these things that take money. And if our economy shuts down, then we have fewer resources to you know, get out to people, and we're getting more people in need. It's not a very productive path to go down. So, you know, I agree that we have to take this common sense approach.
Yeah, there's no question about it. And, you know, remember too that the original value proposition of this so-called flatten the curve was not to prevent America from being exposed to this virus, it was to protect our healthcare system. Because originally we were all nervous when we were watching what was going on in New York. And we thought, as goes New York, so goes the rest of the country. Turns out that wasn't the case. So we decided as a nation, and individual states made these decisions, that we were going to shut down our economy until we figured things out and we could ensure that we had healthcare capacity. Well, healthcare capacity came back online a long time ago. And what happened in New York only happened in New York for a variety of reasons. But the flatten the curve was never about stopping us from getting the virus altogether. It was simply delaying the time when people would be exposed or even people would die, delaying it to a time where we had healthcare capacity. And the result of shutting down our economy, what a lot of people don't realize is we also shut down our healthcare system across the nation. So routine appointments were no longer going on. So, there's a psychiatrist who's a friend of mine up in the LA area, and he's a child psychiatrist, and his volume went down 80% when the healthcare system was shut down. And these are folks that need him on a weekly basis. His benzodiazepine prescriptions, that's Valium and Xanax and Ativan, were the highest ever in his entire career. You talk to cardiologists who stopped doing non-invasive echocardiograms and so forth. You name the specialty, and I'll tell you something that wasn't done that we were missing: critical routine care, annual mammograms for women, pap smears for colon cancer screening, and so forth, just got completely shut down. So I got involved with a physician, Simone Gold, who's a boarded ER doc and also a Stanford educated attorney, and she put together a group of docs to sign a letter to send to the president to alert him of this healthcare crisis. She likened it to a mass casualty event. I think that was true. That evolved into a group going to Washington, D.C., America's Frontline Doctors, that I'm part of. I wasn't able to go to D.C., but she went out there and really rocked the world. So not only did she hold a press conference on the Supreme Court steps, but she held about a 7-hour medical informational conference, not broadcast on the mainstream media. They would never carry us. It was broadcast directly to the American public through social media. And part of the message was that about hydroxychloroquine, its safety and efficacy. Part of it was the overblown notion that we should mask the entire population in order to prevent COVID. And then, of course, opening the schools, which is scientifically such an easy call to make, but our politicians just don't have the courage to do the right thing. And our children, just like our healthcare system that was shut down, our children now are being harmed by being held out of school, unfortunately.
Yeah, and it seems like the whole story, even in San Diego County, what I try to do with these videos is get both sides of the story. We keep getting cumulative numbers, like since March 9th, when we first started counting, from March 9th, here's how many cumulative people have gotten the virus. Here's how many people have been admitted to the hospital. But they don't tell you how many people have been let out of the hospital. They don't tell you how many people have actually gone through the 14-day isolation period and are no longer, have the virus. We just keep adding more and more numbers on top instead of giving the full story. Our hospital capacity in San Diego County, we're at about between 60 and 70% capacity, but that in 90% of that, 85 to 90% of that is just regular people in the hospital. They're not COVID. Our counts are about 10 to 15% people in the hospital are COVID related. Is that similar in Orange County where you are?
Oh, absolutely. And keep in mind, a hospital that's at 60% capacity, that's normal. They're designed to run that way. So you get down to, lower capacity, less people in the hospital, and hospitals don't survive. They don't make money. So hospitals are used to running just as you're describing. So I'm about a 9-iron away from Hoag Hospital as I'm here in my office. And Hoag Hospital is quiet. Yeah, they've got a handful of COVID patients amongst other patients as well. There's nothing unusual going on at Hoag Hospital. There is plenty of capacity. It's at normal capacity. And this is the case with a few exceptions all over the country. So from a risk standpoint, if you're old and you've got pre-existing conditions, take this virus very seriously and do a really good job of protecting yourself. if you're young and relatively healthy, this is no more severe, no more deadly, and should be no more fear-inducing than a bad seasonal influenza. As a matter of fact, more kids die from influenza than from COVID. In California, as you know, Supervisor, we have had, actually, I heard there was one death. We've had literally one death in a child in California, none in Orange County. And yet we're going through these machinations of keeping our schools closed as if somehow children are at disproportional risk. And there's also no evidence that children spread this virus to adults. As a matter of fact, there isn't one single documented case of a school-aged child spreading this virus to an adult. So this clearly is not about education or science. If it was, our schools would be open and our kids would be thriving.
Well, unfortunately, this virus is being hijacked as a political agenda as opposed to a medical agenda.
No question.
I think medically, you know, we're doing the right things. I'm even though I'm, you know, I hear from people that they hate the masks, or, you know, they don't like them. Why do we have to wear them? I say, look, as long as we're opening up businesses, you know, wear the mask. At least, you know, if we're making progress, wear the mask. Agree to that. The social distancing. Wash your hands. But you know, we've done all that, and it has had an effect. The bars, it probably wasn't too smart to open up the bars right away, and we've scaled back on that. But you know, education and business, you know, where we can practice those safety guidelines, I think should all be open.
Yeah, and you know, we can certainly keep our marijuana dispensaries and our liquor stores open, but we're not allowed to go to church. That makes no sense at all.
It's interesting to me, Doctor, and it's less of a question, but we've talked to several people on this. We've done conversations similar to this, and majority have said similar things to you. Everybody's got different opinions. And then the last time we spoke to a doctor, he was very adamant. This is serious. We've got to, you know, Jim, maybe you can even remember some of the things, but he was very opposite side. Why do you think they're so much different? Like, I hear you and I go, well, that makes sense. And then I hear him and I go, well, maybe he's making good points. What's the thought there?
Social media. So remember, in 1968, we had the H1N1 flu, if you will, and that killed something like, you know, millions of people around the world. And what did we do in 1968? Did we panic? Did we shut down the economy? Did we mass the population? No, you know what we did? We held a 3-day rock festival in New York called Woodstock in the middle of 1968. Yet somehow we were able to survive that. You know, we fought 2 world wars and won. We lost 600,000 citizens fighting the Civil War and abolishing slavery, but somehow we're going to let this virus kick our butt and live our lives in fear. That's not to say it's not serious, it is, but it's only serious if you're an older person or have significant underlying health conditions.
I appreciate you coming on and talking with us. I know you're busy. I know you got patients. I know everything's going on, so I appreciate you talking with us.
No problem. And Supervisor, thanks for having me on. I appreciate it. And best of luck in San Diego.
Well, thanks. I appreciate your opinions and views, Doctor.